Heart disease is common in Black women, and heart disease in Black women can lead to very adverse outcomes. Again, this is unfortunately another story in which the healthcare system of the United States failed another Black woman. It's time for us to have a conversation again when it comes to heart health, specifically heart health in women, and even more specifically, heart health in Black women.
I can't take it no more, God. If you let it in, help!
You see, this topic continues to be of great importance because the number one unaliver in the United States is heart disease. And when we say heart disease, it's not just coronary artery disease, which is what most people think about when it comes to heart attacks, but it's also the entire category or umbrella of heart disease, which includes arrhythmias, structural injuries or structural abnormalities, as well as your coronary artery disease. Cardiovascular health is also one of the leading causes of maternal mortality, which is a topic that we have given significant attention to and continues to show us with the latest statistics that we need to continue in that direction. As the top cause of adult mortality in the United States and in many countries around the entire world, there's not a greater reason to talk about heart disease and heart health in general. And even though it is February and we are celebrating Heart Health Month as we do every year, it is not just the designation of the month that makes this topic important at this specific time, but rather the stories that are hitting national headlines that warrant more attention and more discussion. You see, there are two Black women who have been in national news, and perhaps their stories warrant even more attention that they have garnered, but their stories are another reminder of how important it is for us to talk about heart health, and specifically talk about heart health when it comes to Black women and Black women outcomes. Let's talk about that part a little bit more.
I'm a U.S. veteran. She's an Air Force veteran of 5 years. She's laying here with heart failure, fighting for her life, giving everything she got.
A woman at risk of heart failure died.
So there are very common and well-known risk factors when it comes to heart disease. That includes topics that we talk about quite often, including on this platform. We're thankful for everyone who's joining us for the very first time. We're thankful for those who are continuing to support this platform. It tells us that you are prioritizing your health. And that's what's most important to us, the fact that you're receiving the information necessary not only to prioritize your health, but to also take action in improving and optimizing your health. So we thank you for joining us. And if you haven't done so already, go ahead and click the subscribe button, hit us a thumbs up, and go ahead and hit that bell for your notifications. That way you are some of the first notified when we drop a new episode. That being said, let's get into these top risk factors. So some of the top risk factors for heart disease are things that we've talked about numerous times on this particular channel, as a lot of these risk factors are also risk factors for other outcomes. But when it comes to heart disease, some of the most common things that we do talk about that are well-known risk factors, that includes hypertension, diabetes, an unhealthy weight, smoking, increased cholesterol levels, and a sedentary lifestyle. And that last topic is one that we are paying more attention to on this channel because we're finding out just how dangerous a sedentary lifestyle is, including those who have an active sedentary lifestyle. If you don't understand what that means, make sure you hit up our last episode. That being said, let's move on. Now, in addition to those major chronic conditions, there are other very important lifestyle risk factors that we know have been very much linked to heart disease. And that includes a poor diet, someone who consumes alcohol, a family history, advanced age, as well as chronic stress. Now, there's also two more risk factors that I want to mention, and that's because they don't get as much attention, but they are pretty significant when it comes to increasing the risk for cardiovascular disease, specifically heart disease. And that includes poor dental hygiene, and poor sleep hygiene. So, especially for those who have been diagnosed with obstructive sleep apnea, there has been shown to be a link with many chronic outcomes or diseases, which includes heart disease. And many people don't think about the link between your dental hygiene and heart disease. Gum disease, especially, provides an entryway for bacteria to seed into the bloodstream and affect the heart. So keep those two things in mind as some of the other risk factors I've mentioned are things that can be modified, meaning things that you can do something about. Now, when it comes to Black women in particular, we want to pay attention to the disparities that exist. So we know that unfortunately, Black women have a higher rate of hypertension compared to any other race of women, and that only 25% of Black women are considered to have controlled blood pressure levels. The other thing that's important to know is that a stroke or a CVA is more common in Black women, twice as more common specifically when compared to non-Hispanic white women. Black women also are more likely to have undiagnosed diabetes. And as I mentioned, hypertension, diabetes are risk factors for heart disease. So also, as women age and we become menopausal or even just perimenopausal, the body undergoes a multitude of changes. And among the many changes that women experience is an impact on their cardiovascular health. And so menopause is a transition that does impact cardiovascular health. Now, while menopause in of itself doesn't cause heart disease or cardiovascular disease, it does contribute to its outcomes. And specifically, we know that Black women are more likely to undergo menopause at an earlier age, exposing Black women to heart disease at an earlier age compared to other groups. Now, I mentioned that there were two stories that kind of triggered this particular discussion. The first story that really brought back to mind the importance of discussing heart health was the story of Savali Crafts. Now, Savali Craft has been in the news and not on any major outlets, and it really should be, but definitely has been circulating on social media. And if you've come across this story on social media, you know how urgent this particular week was for her health. Now, I encountered this story as a result of a public appeal that her dad made on her behalf as she laid in a hospital intubated. They're both American veterans, so thank you to Savali and her dad for their service and their dedication to protecting the freedoms that we all enjoy. We thank you for your service and we thank you for your sacrifice. He shared that his daughter was being denied medical coverage through the Veteran Services, which is in of itself another conversation that needs to be had, but is such a devastation to dedicate your life to service and then not be able to have adequate medical coverage, especially when you're in dire need, which is essentially what healthcare coverage should be for. Nonetheless, he was sharing that she was in heart failure and needed to be transferred to Stanford Medical Center, who has the equipment and the services necessary to keep her alive. The problem was that the Veteran Services reportedly was not willing to cover the cost of the transporting her from Arizona, her hometown, to California to Stanford Medical Center. Now, as I mentioned, Savali Craft is a veteran. She is a 26-year-old, so she's very young. She's a 26-year-old, 5-year Air Force veteran at that, right? And she is also a mother of two very young children. It was mentioned that she was diagnosed with thyroid disease and an enlarged heart, and it seemed to have been some delay in her care. Again, speaking to just sort of the life demands that Black women oftentimes have to meet, and subsequently put our health secondary to that. Nonetheless, she became very symptomatic, and at the point where she developed symptoms, she sought medical care, and within a week, she became very ill, seriously ill, and went into heart failure. The good news is that because of the efforts of everyday Americans getting this story out. I know I reposted the story as well, because getting the help that we need is so critical when it comes to time. And so because of the mass reposting and great effort to get the story out and to get this family the help they deserve, both financially and just through exposure and awareness. It caught the attention of a congressman from Virginia. And so Congressman John McGuire heard of the story. And as a veteran Navy SEAL who also experienced a serious injury with a broken neck, he understood how important it is to receive the services and to have these services covered. And through his efforts, he was able to help the coordination of her transportation and the payment through the Veterans Services, through Veterans Health. And so now currently Veterans Health is covering the estimated $73,000 cost to transport her so that she can get the life-saving treatment she needs. And they will be covering the entire bill of her medical care. So that is certainly a great outcome. We're happy to hear the outcome of the story, though the process to get to that outcome is quite disturbing. Now, I mentioned in this story that Savali Craft was diagnosed with an enlarged heart, and then she went into heart failure, and that became the urgent need in her when it comes to her health status. Now, as I mentioned, there are different types of heart disease, and similarly, there are different causes of heart failure. Now, so when someone goes into heart failure, it means that the heart is no longer able to meet the needs of the body. It's not able to effectively pump out blood from the heart to be able to oxygenate the other vital organs of the body. So there are different reasons why this can happen, and I'm going to simplify it by talking about two categories before we get into the next story, which is also equally important. The heart can have structural issues. So you have individuals who are born with congenital heart disease, and then you have individuals who develop valvular disease, where the valves become stenotic or less mobile, or the valves become very leaky. So valvular disease is a cause of heart failure, can be a cause of heart failure. And individuals may have other structural problems such as an enlarged heart, as in Savali's case. An enlarged heart can be caused by a multitude of issues as well. But essentially, the muscle of the heart is weakened, and it impairs the ability of the heart to adequately eject blood to the rest of the body. So there are also a group of conditions that cause the heart to have a hard time keeping up with the demand of getting the blood out of the heart to the rest of the body. And so you have conditions that increase the metabolic need of the body, or can increase the pressure that the heart is encountering to get the blood through the vasculature to the other vital organs. And so you also have conditions that affect the electrical functioning of the heart and the muscle fiber coordination dysfunctional, making it very ineffective in being able to effectively pump out blood. So, for example, you have individuals who have arrhythmias. So arrhythmias are abnormal heart rhythms that can be very fast or very slow. But especially those that are very fast can make it quite difficult for the heart to generate an effective pump to get the blood out of the heart to the rest of the body. Individuals who have coronary artery disease, probably one of the most commonly known form of heart disease, are individuals who have blocks in their heart, blocks in the vasculature of the heart, in the blood vessels that feed the heart itself, that make it very hard for the heart muscle to receive the oxygenation needed to get the blood out. So that is your coronary artery disease, and one of the most common cause of mortality for adults in the United States. And then you have individuals who have hypertension, which, as mentioned, is very common, especially among Black women. and hypertension make it very hard for the heart to pump blood out because there's so much resistance in the vasculature of the body that the heart has to work harder to overcome that resistance in order to get the blood through the vasculature to, again, the major organs. And so those are sort of your very basic breakdown of causes of heart failure. Ultimately, individuals who have heart failure just can't effectively pump blood out. And as a result of that, they develop symptoms that can lead to a backflow of blood. So individuals with heart failure may have rapid weight gain simply because the body is not circulating the blood in the way it should. There's backflow of blood, so they may have shortness of breath, swelling in their legs especially. This can make individuals feel very fatigued, very out of breath. Sometimes they can have difficulty tolerating exercise for sure, but not even exercise in general. They may have difficulty even just walking a block or going up a flight of stairs. So they get very fatigued and are intolerant to even the most basic forms of activity. And when that blood is pooling in vital organs such as the lungs, you may experience shortness of breath. Some individuals may have wheezing, almost like asthmatics have wheezing, and develop a cough, and that productive cough can be with sputum that's white or sometimes even a little pinkish. So those are probably your most common symptoms when it comes to heart failure. Definitely symptoms that, as you can see, can be caused by a number of other conditions. So having these symptoms by themselves are not diagnostic of heart failure. So definitely if you're having symptoms like these, don't panic because it may not be heart failure, but it definitely warrants further evaluation and you should notify your healthcare team immediately. Now, the other unfortunately tragic story is the one of C.G. Graham. And C.G. Graham was, and unfortunately I'm saying was because she's now transitioned, a 34-year-old mom of a 2-year-old son. And it's quite sad that this mom had the experience she did. The details of the story is quite disheartening. It is quite infuriating, if you ask me. But definitely one that I think we can all learn from. So let's talk about CG as we honor her memory and allow and make sure that her passing is not in vain, but that we're able to learn from her experience while honoring her life and celebrating her life, and at the same time share information that can protect other women. Let's talk about C.G. Graham. So C.G. Graham in November of 2023 was diagnosed with atrial fibrillation, known as AFib. I know you guys have seen the commercials for AFib, so you're probably very familiar that this is a type of an arrhythmia of the heart in which the heart beats excessively fast. So when she presented to the initial cardiologist, it was reported that her heart rate was 192. Now, C.G. Graham shared a lot of her story in text messages, which was made available to the public. I'm not sure if this is by the family, but it has been made available to the public. And the release of these text messages gives us insight as to not only her experience, but her thought process as she was enduring her symptoms and unfortunately enduring the healthcare system as well. So when she was initially diagnosed with atrial fibrillation, this was reportedly not a new diagnosis for her. She has had episodes before in the past, so she was very familiar with the condition and very familiar also with the treatment and the standard treatment of the condition. It was reported that in the past, she underwent cardioversion. This is a procedure that helps to reset the rhythm of the heart into a normal rhythm. However, when she presented to the initial cardiologist, allegedly, in preparation to perform the procedure, she was noted to be pregnant, and that pregnancy resulted in a change of plan. It was reported that allegedly the cardiologist was apprehensive to perform the procedure because she was pregnant. counseling her that it was not a safe procedure to perform during pregnancy. It was also known that she had thyroid disorder. Now, whether or not that thyroid disorder had some impact on her heart function, that part of the information is not quite clear. But we do know that she had both conditions, a known history of atrial fibrillation. She reportedly was having symptoms of shortness of breath and severe palpitations. If you could imagine your heart racing after you've ran a few blocks, fast, not a jog, but a fast sprint. Imagine your heart rate staying at that level continuously. And that is what CG was experiencing. So when she was counseled about the diagnosis and the change in management due to the presence of a pregnancy, she was then referred to additional specialists for consultation to then determine the plan with the intention of returning to the cardiologist the following week. Now, she was seen by a second cardiologist who allegedly did not even do an EKG at the time of her presentation and who also did not offer her any intervention at the time because, again, of the pregnancy, allegedly. And unfortunately, CG was again sent home. Now, she was sent home still symptomatic, very much pregnant, and very much at risk. Now, atrial fibrillation, again, is an arrhythmia and a dangerous arrhythmia of the heart because it doesn't allow the blood to be effectively pumped out of the heart, which can lead to the formation of blood clots that can travel to other areas of the body, including the heart itself, to other vital organs of the body, including resulting in a stroke and resulting in heart failure as well. As we mentioned with the prior story, having arrhythmias are an underlying cause of heart failure. So definitely she was at risk, and the publication, or one of the primary publications that published the story, reportedly spoke to a number of experts from perinatologists to cardiologists, and there seems to be a consensus that cardioversion is a safe procedure to be done in pregnancy. Now, it is to my understanding as well that cardioversion can be safely performed in all trimesters of pregnancy. And so it is concerning why there was such hesitancy to offer that option to her, especially given the fact that pregnancy in of itself augments heart function in the cardiovascular system as early as 5 to 6 weeks. And so her body was already undergoing a variety of changes. We know that pregnancy also, from the early onset, affects the function of the thyroid gland. And so it wasn't that being early in pregnancy somehow makes it safer for her. It doesn't. There are still significant risks when a mom or a pregnant person is experiencing some type of heart disease or heart issue. And again, a leading cause of mortality. And unfortunately, this case again proved. Now, unfortunately, because CG could not get the help that she was seeking, because she was not offered treatment, not only the cardioversion, but there are also specialists who are saying that there was still an option of admitting her to the hospital and giving her IV medication to try to help her to control the heart rate. But that didn't seem to be an option that was offered to her as well, allegedly, based on the information that has been provided. So it is very concerning and very understandable why it led to her seeking help with an AB. Because at that point, she felt in order to save her own life and to preserve her health as a mother of a 2-year-old as well, that she had no other choice but to seek an AB so that she can then receive the treatment that she is familiar with, that she has received in the past, and she knows is standard care for individuals who are experiencing atrial fibrillation. Unfortunately, CG Graham lives in a state with some restrictions when it comes to ABs. And she encountered barriers, delayed wait times. We know that in states where there are more restrictive laws, there are increased delays to receiving care, women waiting weeks to receive the care that they need, and sometimes having difficulty locating a clinician who's even willing to offer the services or even discuss the services with them. And unfortunately, this case was not unique to that. Unfortunately, C.G. Graham did encounter barriers to receiving AB treatment or even having consultations with regards to her options. And in the process of seeking care and navigating the very complex healthcare systems with new laws that many people are not quite clear on because there's so many gray areas, even for clinicians, unfortunately, she passed away in the process. And it is just quite sad, her passing and the fact that there seemed to have been other options that could have ensued but weren't provided or, to our understanding, weren't even offered to her. And again, it highlights why Black women continue to have 3 to 4 times the rate, and in certain states, as high as 9 times the rate of maternal mortality compared to non-Hispanic white women. This again is another story in which the system failed a Black woman. So what can we learn from CG's story? We learn that unfortunately, once again, healthcare barriers and disparities exist for Black women that continue to not only be barriers of treatment and delays in treatment, not only resulting in us not receiving the same types of treatment and interventions, but also delays in treatment as well are a continued barrier to our healthcare and leading to some of these adverse outcomes that otherwise could have been preventable. Now, remember that the CDC did report that the far majority of causes of maternal mortality are preventable. And C.G. Graham's story, again, is an acknowledgement of that sad and devastating statistic that her passing could have been prevented because the treatment options are available and are considered to be appropriate for her as a pregnant woman. And unfortunately, because she did not receive what sounds to be at least a reasonable option for her treatment of her AFib, she was not given, she was not provided, and allegedly 2 clinicians failed her. And not only did the clinicians fail her, but also the overall healthcare system failed her because the restricted laws in her state, and as with other states, created a barrier in which clinicians were hesitant to provide the care that she deserved. And she did not receive even the counseling that she warranted or that could have saved her life, or at least giving her the information. Also, we can see from her story that there are barriers to being able to immediately leave the state and coordinate care in another state, right? So whereas, or even leave the area community that she's in and get to a healthcare system that would have provided the care that she deserved. So her story highlights so many things and so many barriers that Black women encounter. It's just really sad to see that, again, we have another statistic that could have been prevented. Now, the other things from a medical standpoint that her story highlights is, one, that heart disease is common in Black women, and heart disease in Black women can lead to very adverse outcomes. And the other thing that we can highlight in both stories is sort of the link between thyroid disease and heart disease. And thyroid disease, we know, is very, very common in women as a whole. And subsequent to that is common in Black women as well. So let's talk about that one. Thank you so much for joining me today. I hope you return for part 2, where we get into the depths of discussing the link between thyroid disorders and heart disease. Now, it's a very important topic because so many women are affected by overt thyroid disease, but even more so, there are women walking around with subclinical thyroid disorders and don't know that they are at risk for heart disease as well. So make sure you come back for part 2. See you next episode. Hey you guys, it's Dr. T, the hand behind the handle of Healthy Bum Club, right here on YouTube and healthybum.club on Instagram. Thank you guys for joining us today. I'm out here getting my cardio on. I hope you are too, and I hope to see you guys when the next episode. Bye. Let me get into this track. See y'all later. This is Dr. T, just a friendly reminder, don't forget to comment, like, and share, and go ahead, why not, click that subscribe button, help us to get to the next 1,000 subscribers. We thank you guys for supporting.